This conference will now be recorded.
I first want to thank Brittany, the Student Circle Chair, for coordinating this webinar today. I think it's something that is extremely important and valuable for us to really understand and know about, given the crises and impact that the pandemic currently have on us. So I am going to spend some time talking about COVID-19, the impact that it has on the Black community in particular, and an African-centered approach to surviving and overcoming and recovering from this pandemic. The objectives I am hoping to accomplish for you this afternoon is to overall increase our awareness, knowledge, and skills, awareness about what is happening, the knowledge that's being disseminated, as well as skills in terms of how do we cope. And the idea is that we learn how to cope personally, so then in our professional worlds, whether we are professionals or students, we're able to translate those skills into that, so we are able to survive and take good care of ourselves. I am also hoping that this will improve our self-care and increase our knowledge of self as it relates to our experiences historically and how this pandemic is exacerbating and find ourselves involved in as it relates to the community. I'm hearing a lot of feedback. Can you Okay, and the purpose of today's talk is really for us to understand that as a country, as well as internationally, we are in a crisis. Like, this is a literal crisis that we are in. And it's important for us to understand that, because we have to take inventory of what our response is when we are in crisis. What do we tend to do? Do we tend to resort back to the ways we've been socialized or trained in our academic institutions? Do we resort back to what we've learned in our communities, within our families? How do we take inventory of what our response is typically like when we are in a crisis? So really understanding context that we are in a crisis right now and taking inventory of what that means and how we respond is very important. I also need us to understand how a lack of knowledge destroys our people. So when we are not knowledgeable about who we are, where we've been, and where we're headed, it could really destroy our people. And a lot of examples are demonstrated throughout the media, social media, et cetera, as it relates to the lack of knowledge that we have as a people and how that's really impacting the outcomes, the poor outcomes we are having as a community. Also, very important for us to really understand we are living history, and understanding we are living history, going back when we think about Sankofa, revisiting and examining our history and how have our ancestors survived the different crises we have found ourselves in. So when we think about enslavement and Jim Crow and all the historical injuries that we have been subjected to as a community and as a people, our ancestors have been there and done that. How did they survive? And we know they survived because we're here to actually have a conversation about it today. So understanding that we are in crises, we are living a history, and what does that mean? And how do we make sure we have the knowledge that's going to help us uplift, liberate versus destroy? I am going to attempt to do this by, number one, demystifying COVID-19. Bringing clarity to what's actually happening, I think, is significantly important, again, because of the misinformation and some of the myths that are happening within our community, unfortunately, is contributing to some of the negative outcomes that we are seeing as a community. So understanding the severity without panic, making sure we dispel some of those myths that we are seeing in our community, understanding the impact overall. How are we being impacted socially, spiritually, psychologically, emotionally? The overall impact that this crisis has on us is very important. We know that we're stressed, but do we really understand the impact at various levels in terms of how we are experiencing this pandemic? And then more importantly than anything, how do we survive? So I'm hoping to do all of those things for you in the next hour or so. And again, if you have questions as I continue, feel free to ask, or if it's something that can be held afterwards, that's also okay. So I just want to just give a brief overview of what COVID-19 is. I'm not sure how many of us are watching the news daily or, reading our social media accounts and following. What I will tell you is that if you're watching too much of the news and too much time on your social media accounts, what I will assure you is you are probably extremely anxious and have high anxiety and high stress. Which is to be expected because a lot of the information, unfortunately, is negative and is demonstrating the very dark side of the pandemic and not necessarily some of the other things that are coming of this crisis that we're in. And so I want to be able to just say specifically what COVID-19 is. Again, the purpose is to make sure we have facts and that the information that we have is relevant to how we need to govern ourselves as a people and how we recover and respond. So again, we understand that it's a pandemic. It's a respiratory disease that's spreading from person to person. The CDC has mandated that it is, in fact, a pandemic, meaning that it's impacting everyone across the globe, and that there are some very specific preventative methods that we need to do in order to keep ourselves safe and to prevent it from spreading further. And so even when we talk about language, I like to think and make sure that we understand semantics, because again, when we're talking about managing our anxiety and trying to decide how we survive, how we understand what is being communicated is significantly important. So even just saying that we are doing these things for prevention sounds very different than you must do these things or these horrible things will happen to you. And so again, understand that we are doing things to prevent the spread and to prevent us from contracting the disease or whatnot. It's really important for us to understand in context. Again, how we understand information can either contribute to, exacerbate, or maintain any anxiety or anxious distress that we might find ourselves experiencing. The U.S. Nationally is in the acceleration phase of the pandemic. I will also say this, I've done this webinar a couple times now, and so I'm understanding that the stats have also changed. So the stats are changing daily or weekly. I do know here in Ohio, which is where I am, we are getting weekly updates on the stats specific to our state, which is another point that I want to make sure that I talk about. Look at what's happening within your state and within your local communities. Again, just making it more specific to risk and preventative measures that are happening within your community and state. It's easier to kind of retain or take in or receive that's not going to be exacerbated. So when we look at this globally, the numbers are so horrific that it just increases anxiety. But if you look within state to state where you are located, the numbers are going to be much smaller. And again, we are trying to understand information as it relates to us and our community, so we're not panicking or exhibiting more anxiety. So I do want to make sure that I say that as well. Look at pay attention more so what's going on in your community within your state, because that'll give you an avenue as it relates to how prevalent or pronounced this is in your community. What are some things you need to be doing specifically to keep yourself safe, your family, your loved ones, your community, etc. Based on the currently available information and clinical expertise, we've known, and again, this is initially that the virus was more attacking of people 65 years and older. And again, more so in the beginning, people who live in a nursing home or long-term care facility, and then those of us with underlying medical conditions. Those seem to be initially the most vulnerable population as it relates who was contracting COVID-19 and who was dying from it. According to the latest data from Johns Hopkins, around 370,000 Americans were infected. Again, this data is from a couple weeks ago, so I'm sure that number is heightened. 11,000 have died, but again, I think Brittany shared with me this morning that it was over 40,000. I am going to pause for a second because I know Brittany was looking into the updated stats that I think might be important, so I'll let her share about that right now.
Yeah, so all I have is just that. So just that it's over 40,000. It could be like over 41,000 at this point, but that's the last number that I saw. And so I did have, well, there was a comment since you paused, and I can let you figure out if you want to address this now or at the end. So Ms. Maisha said that language is important. So thank you for that reminder. And do you have a different word for pandemic? She's heard some elders say so-called pandemic. Wait, did you? So my screen is changed. I don't know if yours has.
I don't know what happened. Something happened to the screen and I didn't hear the last part of the question.
So she wants to know if there was a different word to use instead of pandemic because she's heard some elders say so-called pandemic.
That's a great question. I don't know if I thought about a different term for pandemic, but I will think about it. So maybe if something comes up, we can address that towards the end. But yes, I also think it's very important. And I don't know. So yeah, let me get through the slides as I continue to unpack how it's impacted us as a community, because perhaps pandemic is not a strong enough term to use in terms of how we as African Americans understand our experience of it. But yes, I think that's a great question. So let's get back to that after we're done. The spread of the disease is highlighting levels of racial and ethnic disparity across the country where many African Americans continue to struggle to access health care. What I find to be very important is a high level of pre-existing conditions is also thought to be exacerbating the disease. And again, and the disproportionate fatality rate. So when we think about us as people of African descent, African Americans in particular, we lead the country, unfortunately, in high blood pressure, diabetes, cancer, and other health concerns that we see that usually result in death. And so as an African American community, our health outcomes are significantly poor. Even just our life expectancy rate is significantly lower than that of non-African Americans. So we have to be able to hold that in context as it relates to why we're dying at such a higher rate than non-African Americans. So, okay. So when we think about the impact on the Black community, again, these stats came out April 6th. So that's what, 2 weeks ago. Yep, 2 weeks ago from today. Here's what we know for certain in terms of the impact on the Black community. We collectively, per state, make up a certain percentage of the population, but we are dying at a rate that either doubles our population. So for example, in Louisiana, African Americans make up 32% of the population, but out of the people that have died in Louisiana, we make up 70% of that population. Again, just highlighting the great disparity as it relates to how we're contracting and dying from this disease. Illinois, we make up 15% of the population, but out of those who have died, we made up 42%. Michigan was 14% of the population. The death rate for African Americans, 41%, 22% population in North Carolina. Out of the people who have died, we made up 22%. Then we have Chicago, 30% of the population. And those who died, African Americans made up 69% of that population. So again, and I have the stats from Ohio that I looked at last night, very similar, making up about 16% of the population, and 30% have died out of the people who have died. So again, it just really highlights the devastation on African Americans. We don't make up that much of the population, but the rate at which we are contracting the disease and dying from it is at a significantly higher rate than that. So again, the stats are very, very important for us to understand and increase our knowledge and awareness about, because it does drive how we respond and what we do about it, and how we tend to educate ourselves, our families, our community, and et cetera. This is more data about the impact on the Black community. So again, even though 33% of people who were hospitalized were African American, again, we only make up 13% of the US population. A lot of the cases that have been hospitalized have been due to developing a serious illness or who have a preconditioned illness, whether it's been diabetes, lung disease, heart disease, gastrointestinal symptoms, etc. About 90% of people in the hospital with COVID had at least one underlying health condition. And again, I can't really see my screen, but you can see the percentage at which people had either high blood pressure, obesity, chronic lung disease, and etc. Again, just really highlighting the impact that the disease is having. And again, this is important for the Black community because unfortunately, it's our community that's impacted with these underlying medical conditions. So understanding that as it relates to what we do and how we prevent and keep ourselves safe, we have to also take greater interest in taking care of our health in general. Some of the myths, again, the myths that I have been experiencing or privy to as it relates to my community. I'm not sure if you all have any to add. I'm not sure where everyone is calling in from, but we have seen a lot of myths as it relates to how we think about COVID-19, and feel free to share either in the chat or jump in if you've heard others. But something that was very prevalent when this first happened was Blacks can't get it. So there was this whole idea that, oh yeah, this is happening. It's a white people disease or it's an Asian-based disease. We can't get it. We're immune to it. And so unfortunately, what we saw in our community was people were still out doing their norm when we had the CDC and the governor saying, no, we need to practice social distancing. We need to make sure we're doing A, B, C, and D to keep ourselves safe and to prevent the spread. It took a while for people to get on board because, again, we didn't understand the impact, number one. Number two, and more importantly, we didn't understand how this was going to devastate and exacerbate the conditions that we already experience as an African American community. We've heard myths about we are biologically superior. So because we are genetically superior, our immune systems are stronger and we're not going to be able to get this disease, or if we do, it's not going to impact us the way that it's impacting other people. And again, the data coming out to initially focus on the older population, again, unfortunately, allowed people to believe that it was only limited to that population initially. There was no information that came out. Vulnerabilities of specific communities like that of the African American community. In fact, we just started focusing on that data last week. And then again, there are several conspiracy theories that are going around the media and social media about why this is happening. And not to say that conspiracy theories don't have validity or utility, it hasn't been helpful as it relates to what we're doing as a community and understanding the impact. So again, we're trying to figure out why this is happening or attach different theories to it. And we are away from what it is we should be doing collectively as a people to survive it. And so just those are some of the things that I know we have dealt with specifically in Ohio. I'm not sure what other people's experiences have been as it relates to where you are, but again, just kind of think about that. Just think about some of the myths that you have been subjected to or you've been hearing amongst your community. When we talking about conceptualization, again, so we have conspiracy theories, but in terms of conceptualizing this from an African-centered perspective, I like to rely on the work of Dr. Linda James Myers, whose theory that we really buy into, adhere to, and use at the practice that I'm associated with, Minority Behavioral Health Group here in Akron, Ohio. We really use Dr. Myers' optimal conceptual theory to really understand the experiences of people of African descent as a whole. So naturally, when there's a pandemic and a crisis, absolutely, we are going to understand it from this perspective, because this perspective is aligned with who we are as a cultural being. And so optimal conceptual theory, again, is perfect because number one, it's going to look at the historical context, right? Historical context is very important as it relates to how we're being impacted and what our responses have been, whether it's the discussions we're having, whether it's the behavioral responses, whether it's the emotional responses. We have to be able to take inventory of how we are responding in a crisis. And again, we want to look at historical context so we can make sure we stay collective and joining with each other and not divide or turn inward and ridicule each other or ostracize each other because we're not on the same page. But when we think about historical context, there's a cultural mistrust that we must understand as it relates to why our response was kind of slow to really adhere to some of the recommendations that we were hearing from our state governors and then from the CDC in particular. Cultural mistrust, and I remember sharing with my team, and we say this all the time, it's hard for us. We're not listening to white folks. It's hard to listen to white folks when there's so much mistrust there about how African Americans are impacted, what they want to do. Again, there's this whole thing about them wanting to use South African population to see if the vaccine worked. Again, when we think about the Tuskegee experiment, there's tons of things that have happened within our history that will make us suspect or questionable about what we're now being told in a pandemic. And so just being able to really understand that context and why we might be mistrusting of information being shared, I think is valid. One thing I want to caution us against is it's okay to be skeptical and to critically evaluate what's being said and to really put what's being said through our context versus dismissing it altogether. Unfortunately, dismissing it altogether has contributed to some of the negative and poor outcomes that we see within our community. So it's not that we want to dismiss it or not listen to white folks, but because of that historical injury piece, we want to make sure that we are questionable, we are questioning the information, we are skeptical, we are critically evaluating it and putting it through our context so we know how to respond and what we need to do as a community that's going to uplift, liberate, and help us recover. The other piece as it relates to historical context, not only do we want to understand how this has, contributed to our mistrust, but also our ancestors have been here before. So we also want to go back and look at how did our ancestors survive? What did they do to survive enslavement? What did they do to survive Jim Crow? What did they do to survive as we're still trying to survive mass incarceration? But when we think about how we have been injured as a community, historically, our ancestors survived. And I want us to be reflective and remembering how did that happen, because that's what we need to tap into and build upon in order to survive yet another crisis, pandemic that we are currently going through. Dr. Myers also talked about the impact of oppression and how oppression really plays into exacerbate, maintain psychological distress, right? So again, here's another opportunity for us to really look at the oppression that we are subjected to on a regular basis. So not only do we deal with oppression globally on a regular basis, we now have a pandemic on top of that we now have to deal with. So again, when we think about already existing health disparities, that's a symptom of oppression. When we think about poverty and the poverty rate, that's a symptom of oppression. So just understanding the oppression and how it plays into our understanding of self, our view of our community, our view of our leaders, our view of our values. Again, living in a world that is oppressive really impacts how we see ourselves, what we respond to, how we respond, how do we interact, where we place our value, etc. So understanding that, especially within the context of this pandemic, will help us, again, to understand how we are collectively responding as a people. And because we are living in a world that is oppressive, it does influence our worldview. So Dr. Meyer's work also talk about having a worldview that is more grounded in African-centered values and philosophy. It really protects us from the oppressive world that we live in. Unfortunately, when we adopt a worldview that's suboptimal, Eurocentric in nature, that places value on materialism and individualism and things that you can count and measure, it really does create a worldview of psychological distress. So making sure that we tap into understanding our worldview and how that's playing out or being shaped by the current pandemic. And again, when we look at it, if we are aligning ourselves with things that are consistent with our collective nature, being in a spiritual understanding of self, when we are able to when we are able to tap into our worldview and see how it's aligning with our African-centered value and belief system in terms of what we are doing, it serves to protect us. And when we rely on a suboptimal worldview, it really creates more anxiety and more distress. So Dr. Meyer's work really taps into the historical context in terms of some of the current behaviors that we are seeing that's not serving us well. But again, let's also examine what our ancestors did that did serve us well, that kind of helped liberate and help us survive the different pandemics that we found ourselves in throughout our existence. And again, making sure we understand that worldview piece, that we must align ourselves and reground ourselves with who we are as a cultural being and not rely on the suboptimal worldview. What I will tell us is when we are in distress, more times than not, when we find ourselves in crises, in distress and anxious, unfortunately by default, we resort back to what we have been socialized to believe. So we resort back to those anxiety-provoking thoughts and beliefs. Again, you see it play out in our communities where everyone is more concerned about the materials versus the interpersonal relationship. So people want to go out and do things that's really impactful and not necessarily grounded in what we should be doing as an African-centered people. So OCT, historical context, oppression, worldview, in terms of how we understand the pandemic and the impact that it's having on us. But again, more importantly, what do we do to survive it? The health disparities, I just really wanted to highlight again. Again, a symptom of oppression. This is what we see, right? Differences in life expectancy and death rates were the highest for diabetes, heart disease, cancer, HIV/AIDS, stroke, homicide, the infant mortality rate, and again, mental health. So right now, as a people, as a community, we are leading the country in stats as it relates to how this is prevalent in our people. But again, we only make up 13% of the US population. So just understanding that, again, hopefully will kind of shape our response and how we deal with it moving forward. The psychological impact, again, we see it. It's very clear. We see the anxiety, depression, trauma. It's very traumatizing for most of us. We see an increase in child abuse and neglect cases. We have families at home. People have lost their jobs, their income. Kids are not in school, so they're home all day. Unfortunately, because we don't know how to respond spiritually and culturally using an African-centered framework, we resort, unfortunately, to that suboptimal worldview. It's reasonable that we see these child abuse and neglect, domestic violence incidents increase, unfortunately. I mean, again, it's a symptom of being outside of who we are as a cultural being. So yes, in the communities, DV has increased by 30% or more. There's been an increase in substance use. And again, we see a lot of grieving and loss as a result. So again, the psychological impact is very important for us to understand. There's a lot of emphasis being placed on the health. So we hear a lot about, the hospitalization and the impact of the disease on our physical health. I would argue that the psychological impact is just as critical. And we are going to see so much residual when we finally come out of this if we don't understand who we are and how to navigate it in the midst. So we also should pay attention at the same time, the psychological impact that this is having on us individually and collectively. The level of stress that we are experiencing, again, we experience stress both psychologically and physiologically. Again, there's a difference between stress and the stressor. The stressor being the things that cause the stress. I think it's very important to differentiate that because, again, the stressor is the pandemic on top of the other forms of oppression that we already are dealing with. So we have regular forms of oppression, if that's such a thing, but now we have a pandemic on top of that that's exacerbating that stress. So the stress is what we are experiencing psychologically and physiologically, but the stressor is the pandemic on top of the oppression that we already experience as a community. The physiological impact, again, when our bodies are stressed and we have a stressor impacting us, our body sense danger. And so what do we see? We see that fight, flight, or freeze response. Again, that's in response to danger. It's in response to what we perceive as trauma. And we see a lot of that. So I encourage you to take inventory. How are you responding? Again, evaluate. What are you doing? Are you fighting? Are you fleeing? Or are you freezing? It's something that's very important for you to understand because we must pay attention to our bodies, right? We have to take care of our bodies in order to survive this. So what is your body doing physiologically as it relates to managing the different stress? If you feel a heart rate increase or blood pressure increase, muscle tension, an increase in your hormones, then you know that your body is responding in a way that is dangerous and detrimental. Stress can be helpful sometimes because sometimes it can alert us to do something, but when it becomes chronic stress, then it can be damaging and it can cause significant damage to the body. Again, when we think about the health disparities that we already experience, a lot of that is because of the chronic stress that we're under. Again, chronic stress related to the different various forms of oppression that we experience as a people. So we got oppression, we got chronic stress, then we have all of these health disparities as a result of it, and now we have a pandemic on top of it. So again, something that's very important for us to consider in context as it relates to what we need to do in response. This chronic stress, of course, can lead to chronic anxiety, fear, feelings of helplessness and depression. It decreases the immune system functioning. We experience pain, sleep disturbance, and overall negative coping. And again, that decrease in immune system is important because we need strong immune systems to beat this COVID-19 if we are unfortunate to contract it. Like one of the main things is having an immune system that's strong enough. The people who are surviving are able to do so due to their immune system functioning at a healthy level. So I'm going to shift a little bit in terms of how do we respond to the pandemic. Now, these are thought-provoking questions. These are questions that I encourage you to jot down and to reflect on. I'm not sure that you can answer this now, but it is something that's extremely important for us to consider. When we are in crises, again, understanding that when we are in crises, we tend to resort back to unhealthy, suboptimal ways in terms of how we've been socialized to respond. But more importantly, how do we keep our rituals going? Number one, do you have rituals? What are your rituals? Are you aware of them enough that you are practicing them daily? And if you are, when a pandemic hit, how do you keep that going? The second question is, how do we rely on our understanding of self? Again, going back, examining our history, how do we remember who we are and what our experiences are? Again, because it's going to help shape how we move forward. So how do we hold on to that when we are in the midst of a pandemic and crises? Third, how do we rely on the foundation laid by our ancestors? Do you remember? Like, so when this is happening, has anybody said to self, like, wow, our ancestors been here before? This is what they've been doing. Let's tap into. Yes.
Some people are saying that they lost their sound.
Yeah, because I can still hear her, so I didn't even know how to go about troubleshooting that. Oh, they say it's back.
Okay. Okay.
We're good. How much sound did we lose?
I think
Just
it was
like a minute. It wasn't long at all.
Oh, okay.
Well, when people said something anyway, but everybody's saying it's
so
back. Yeah, he said
probably
about a minute.
slide.
Okay, we're good.
Mm-hmm.
All right.
Thank you.
So
Wait.
my third question, I don't know how much of it was heard or lost, but how do we rely on the foundation laid by our ancestors? Again, have we been able to look at and say to self, like, wow, our ancestors have been here. It's okay. What did they do? And how do we tap into the things that our ancestors have done and laid out for us to do in the midst of the crises that we are in now and that we will get in the future?
Can you hear me?
I can.
Okay, so people are requesting that you start over after. You may want to jot down these questions.
All right. So back to the slide, responding to a pandemic. These are 4 questions that I think is very important for us to reflect on. Again, when we are in the midst of a crisis and a pandemic, we often resort back to unhealthy ways of coping or things that we've been socialized to believe. So my first question in terms of reflection and what is important for us to think about is, how do we keep our rituals going? How do we hold on to our existing rituals? Do we have rituals that we practice on a daily or regular basis? If not, we'll talk about that later on in the slides. But if you were doing that prior to the pandemic, how do you keep it going? Understanding that our life circumstances have shifted and the majority of us are now at home, working from home, attending classes from home, and etc. How do you hold on to your rituals? The second question, how do we rely on our understanding of self, understanding who we are, who we come from, where we come from, and what our experiences have been as a people? How do we hold on to that understanding so that it continues to shape our response and how we move forward? Third, how do we rely on the foundation laid by our ancestors? Again, I keep reiterating, and I can't reiterate enough, our ancestors have been here before. What did they do? How do we tap back into that and understand what it is we are supposed to do based on the foundation they had laid for us? Because again, we are in the midst of a crisis, and it's likely that we'll see a crisis like this again in the future. So how do we tap into what our ancestors have done to survive these different crises? And then fourth, how do we adhere to our cultural worldview and practices? Do we remember? Do we know? Can we tap into it? And how do we be more intentional, right? We're in crises. How do we be more intentional about holding on to our cultural worldview and our practices, so by default, we don't resort back to these unhealthy Eurocentric ideals and ways that we constantly hear about throughout social media, throughout the media, within our society, within our academic institutions, unfortunately, sometimes in our own homes. How do we buffer against that? And we do so by being more intentional about who we are as a cultural being and a spiritual being when we are in the midst of crises. What I think is important for us to understand, although society at large is experiencing life under these conditions of terrorism, the experience of terrorism in this society is not news to us as people of African descent. It's not new. It's unfortunate, it's inconvenient, but it's not new. And so again, what do we do in terms of survival?
Dr. Tania. So first I'll say that there were questions that I'm going to go back to at the end for you, but somebody asked a very specific question about what you were just discussing. So they asked, what suggestions do you have for those of us with small children, 1-year-old, and the impact this will have on their social development and lack of connection with family members outside of the home?
We're going to get there. So when I get to what we do about it, I'll get to very specific strategies in terms of what we can do. Okay. So did you have another question, Brittany? That's it? Okay. So in response to COVID-19, African-centered values, principles, rituals, and worldview is what has sustained and promoted the survival of our ancestors and currently serve as protective factors for people of African descent who have experienced years and years of terrorism, racism, and oppression. There's tons of research, African-centered research, that talks about the protective nature of having an African-centered worldview, of endorsing African-centered values and principles. And the more we align ourselves with that, it really does protect us. The studies show that either we experience depression and anxiety at a higher rate when we don't. When we do, it's not as impactful, or we at least know how to navigate and cope in a healthy way when life does happen. And unfortunately, we do experience stress. So tons of research that's already out there that talk about the importance of adhering to and practicing our African-centered values, principles, and rituals is what sustained our ancestors historically, and it does serve to protect us from current day various forms of oppression. Our history teaches us that challenges to health and our safety, fueled by a lack of information and out of ignorance and bigotry, ignites people's anxieties and fears of others, particularly us. This is a statement that was made by Dr. Bobaway Nobles in his article that I'm also going to reference later on, that he sent out to kind of help us to really understand and ground ourselves and what's happening and how to survive it. And again, COVID-19 is not exempt from this peculiar response. So again, just speaking to the importance of understanding our history and how do we navigate and deal with what we're dealing with currently. In terms of self-care, so I'm going to shift into some of the strategies and hopefully it answer some of the questions that I know that we have about what to do specifically. So again, yes, I have on here that we do want to follow the recommendations of the CDC because unfortunately, it has been proving to help prevent the spread. So if the CDC is saying let's maintain social distancing and, wear your face cloth in public, make sure you're washing your hands, disinfecting, blah, blah, blah. We want to make sure that we are able to do that as long as we need to do that. But again, when we're talking about African-centered values, virtues, principles, our worldview, there's specific things that we can tap into to kind of help shape our responses. So we have our virtues of Maya that I'm going to further flesh out. We have in Huzu Saba, the 7 principles of Kwanzaa, a value system that has been developed to help sustain and celebrate who we are as African people. Dr. Bobaway Nobles developed the 5-star family enhancement plan that I'm also going to talk about and highlight. Hopefully you all have access to that article. Dr. Linda James Myers, again, I referenced her theory earlier on, and I'm sorry, her name is misspelled here. It's not with an E, but Dr. Myers' work we are already adopting, but again, she also produced an article in response to COVID-19, and that's called Increased Knowledge of Self. And then from her work and her therapy, belief systems analysis, there are African-centered principles grounded in that theory that we also want to make sure we're tapping into as it relates to how do we respond. So I'm going to bypass the CDC because, again, it's just very basic, and you guys will have access to social distancing, washing hands, etc. I really want to spend time on the African-centered piece as it relates to how we're responding. So the virtues of Maya, we have the 7 virtues that have been developed to really help shape, our moral code, our spiritual understanding in terms of how we want to just operate as a people and as a community. And so very specifically, when we look at the virtue of truth, a lot of what's happening throughout the country as it relates to understanding the pandemic, again, is misinformation and myths that have unfortunately impacted the outcomes as it relates to how we are contracting this disease and how we're dying from it. So the more we are able to seek truth and facts and share with our communities, within our families, with our loved ones, and just understanding it for ourselves, it really helps ground us as it relates to who we are. but not just truth as it relates to the impact of COVID-19, but truth in who we are. So again, going back, understanding who we are, looking at our history, getting that truth in terms of our experiences, if we're able to reflect and attach that information to what's happening, again, it's going to really help ground us as it relates to how we respond and the level of impact psychologically that this pandemic have on us. Justice, increasing our courage and commitment to stand up for what is right, just, and fulfill the role of our ancestors. So again, we have this information. You guys are now benefiting from this information. What are you going to do with it? Are you going to share it? Are you going to give it to people? Are you going to practice it? So making sure we are being courageous and committed to the cause, staying true to who we are in our African-centered selves, and making sure we are exemplifying that in our existence. As it relates to harmony, again, are we practicing our rituals? Are we meditating? Are we being mindful and grounding ourselves in relaxation techniques that are culturally grounded? Are we dancing? Are we drumming? What are some very creative things we are doing to keep ourselves in harmony with each other, with our higher power? How are we creating that space? Again, we can create that balance from, again, engaging ourselves in rituals and meditating and praying and etc. Balance is the fourth virtue of M.Ed. Again, so most of us are working from home. We are attending classes from home. Working from home, at first it sounds nice, like, oh great, we get to work from home. But again, it's very taxing, and the different impact physiologically and psychologically that it's having on us is becoming problematic. So we want to make sure we create balance. If you are working from home, you want to get up as if you're leaving the house to go to work. Get up, have your morning ritual, whatever that might be, whether it's an African proverb, a self-affirming statement, something, you pour a libation, you honor your ancestors, whatever rituals you can come up with. You want to make sure you start your day with a ritual, take your shower, have your breakfast, and then you go to your workspace. Delegate workspace, whether you're going to school or to a job, delegate the space, have time for that, and then turn it off. Most of us have been, unfortunately, just working throughout the day, all day, every day. And so there's no balance there, which is unfortunately creating more stress and anxiety, lack of motivation, some of that depression. We got to be able to tap into balance as it relates to us being at home, trying to navigate these things that we were once doing outside of the home. Another important thing that I want to recommend as it relates to balance is limit your news consumption and your consumption on social media. Again, for the most part, it has been negative and detrimental. Most people are having heightened anxiety and depression because of the negativity and the different conspiracy theories that are circulating through media. And so we want to stay informed, right? And it's also a way to connect socially, but we want to make sure that there's balance there. Something else I want to make sure we're balancing, I'll get to that at a later time. But again, it's not limited to these things. These are just some creative ways to kind of help attach the virtues to some of the things that we are experiencing currently in our homes. We want to make sure we have order. Stick to a routine. We need a routine more importantly now than we probably have in the past. Why? Because we're limited to our homes. A routine comes natural when you know you have to be at an office at a certain time, you get a lunch break at a certain time, or you change courses or classes. Like a routine, in some ways have been naturally set for us, but we don't no longer have access to that now that we're in the pandemic and at home. So making sure you create structure in a routine daily is really going to help with your motivation, your energy, and being able to have space and room to do some of these activities with your children if you're home, or if you're home with your families and people have cabin fever and just losing hope and don't have a lot to hold on to. If we have order, and again, this works for your kids too, if you are at home with your children, make sure that there's a routine. Having that order is going to help us be more clear and grounded in how we respond to some of the things that we're responding to. Reciprocity. Reciprocity is a huge one as it relates to taking care of our bodies. when we think of our bodies, we were provided these bodies by our Lord and Savior, our higher power. We were given this, right? It's divine. How do we reciprocate taking care of the bodies that we were provided, right? Physically, mentally, spiritually, how do we feed that? And we reciprocate it by doing everything that we can to make sure that we are taking care of our body. We're taking our medication. We are eating healthy diets. We are taking our vitamins and our supplements. We are doing things to strengthen our immune system. We are doing things to kind of help keep us grounded mentally and spiritually. So we want to make sure we're reciprocating, feeding the physical body by making sure we're taking care of our spiritual health, our mental health, and our physical health. And then propriety, making sure we're doing our part. We want to follow order. We want to use our knowledge, our gifts, and our creativity to create harmony in a community. So these are some very specific ways, again, not limited to this list, just some examples of things that we can do to kind of help exemplify M.Ed. When we're talking about, yes.
So there was a question, I think it may have been connected to justice or really injustice. So the question was, do you have any suggestions for helping communities of color wear face masks? I've been working with a lot of people who don't want to wear face masks in public due to racial profiling.
So as it relates to the face mask, again, so here's what I'm going to say. There's several recommendations that we're hearing, that we're getting from the CDC, from our state governors, and et cetera. So there's a lot of reasons, and this is my point, there are a lot of reasons why we may be resistant or reluctant to it. The only way that I know, understand, and see that we can really bring balance to that is by educating on the importance of it, right? So just what I'm talking about M.Ed and how do we exemplify M.Ed? Or even when I get to Nguzo Saba and some of the other strategies I'm gonna get to, how do we educate our people to help them receive the information versus it be this combative discussion, and then there's more reluctance, and then there's division amongst our people. We have to be able to provide the education and the historical context, help people understand what they are responding to, validate it, because unfortunately some of it is valid, but again, are you putting us at more risk by resisting, or are you going to help us collectively by doing some of the things that we know will help our community specifically? So again, it's being able to educate from this perspective in terms of why that response is what it is, and then how do we, interject some things that we could do. So tapping into M.Ed and saying, hey, M.Ed, this is how our ancestors, lived prior to the period of enslavement. Like, this is what life was like. This is what we were doing. And these are the things that have sustained us. So being able to attach behaviors to our virtues, our values, and our principles, or talk about how it's not aligned with our values, virtues, and principles, in my experience, has helped people receive information better, that they are able to have some behavioral change. So Nguzo Saba, again, so we have unity, right? Umoja, staying connected. So we're hearing all this social distancing, and how we think about that has also been interesting, right? So it's causing a lot of depression and a lot of disconnection. And there's also been recommendations in terms of, again, semantics. Let's use language that's going to promote more connecting versus disconnecting. So let's not call it social distancing, let's call it social spacing. We still need to be able to connect socially, whether we're having virtual meetings like this socially, whether it's getting together with our friends, our peers, our colleagues, family members. There's still ways that we can remain connected that's not going to isolate us further or feel like we have to be isolated. We want to check on our loved ones and our colleagues, our peers. We want to be able to validate everybody's experiences. We are all stressed, stretched, traumatized. Like, we're all experiencing these things collectively. So we should be able to openly discuss it, talk about it, validate it, share our vulnerabilities and challenges, and just normalize the thoughts and feelings that we're having. We want to be able to create that space where we can do that, because again, once we're able to do that, it will shape how we respond and the things that we do moving forward. As it relates to self-determination, make a plan of action. So we are at home. Let's take action and be courageous. Let's improve our health behaviors. Again, a risk factor to the poor outcomes is our health. We're already in poor health as an African American community. So how do we really improve our health overall? Whether it's, just doing some stretching or exercises around the house. We can't really get out and do a whole lot. Most people can go and take a walk, but doing things physically to improve our health. What can you do? How can you be determined to do something different that's going to improve our overall outcomes? Again, take some vitamin C, vitamin D, strengthen that immune system. So again, these are things that we can be more intentional about doing that can kind of help us to buffer some of the impact that this is having on us. Collective work and responsibility. We want to make sure we're providing support and encouragement. We want to make sure we have a collective effort to help improve our overall circumstances, honor the collective, make available resources. So if you are aware of resources that are available in your community or within your field of study, make sure you're disseminating that information out. Sometimes we don't know what we don't know, and a lot of people don't know what we know. So even if it's a chance that they might know the information, share it. You get an email or a resource about unemployment, share it with the community at large, about loans and, just the different things that we are being afforded to some degree. Make sure we understand what these resources are and we're able to share that information with the community at large. Unfortunately, a lot of us don't know that these resources are available or exist. So what we know, we should be sharing and making sure we have that collective effort in terms of how we're able to access some of the things that may be available. Cooperative economics, most businesses are shut down. Again, any way that you can, continue to contribute to Black-owned businesses. So we see that here in our community a lot. We have a lot of Black-owned restaurants. You can either go and either, buy takeout from those places or still order things from Black-owned businesses that you see circulating over social media who might be selling self-soothing, relaxation materials, hand sanitizer, and etc. So making sure we're still able to support and pour love into the Black-owned businesses that we know are suffering at this time. As it relates to purpose, living and doing things with intention and purpose, tap into your gifts. Use your gifts to increase meaning in life. We all have them. And now that we are at home and may have a little bit more time on our hands than we would normally have, examine what your gifts are and make sure you're doing things with intention and purpose because you have it. We all have divine purpose. We're here. What is your purpose? Do you understand it? And what can you do to kind of facilitate and cultivate living in that space while we're here? Creativity. Again, a huge recommendation, learn something new. We're at home. We're at home with our families. Expose our kids to something new. Let's get involved in some creative activities that we can do. What you water and feed grows, right? That's one thing we know. Water and feed your gifts so they will grow. Now is a good time, unfortunately, to be able to sit at home and be more intentional about putting some of these things into practice. Unfortunately, when we were living the life that we were living prior to the pandemic, a lot of that was just happenstance, autopilot. We're just trying to survive the moment. We got school, we got work, we have all these responsibilities. We're parents. We have multiple tasks that we're trying to navigate. It's hard to really be intentional about our purpose and our creativity and live in that space. This pandemic, unfortunately, is going to allow us to re-examine and reshape some of the things we were doing that was not as intentional that could be moving forward. And then faith, right? How do we keep our faith? Keep faith in self, faith in our community, and more importantly, faith in our community leaders. Making sure that we keep the faith, again, helps ground us and have helped ground our ancestors when they were battling such terrorist acts during their day and time. Dr. Baba Wade Noble developed the 5-Star Family Enhancement Plan. Very, very, very helpful and invaluable as it relates to some tangible things that we can do. I'm going to briefly share with you the 5 R's, but again, there is an article that has been circulating around. Hopefully you guys have seen it and have access to it. If not, I'll make sure, or Brittany is on the call, I'm sure she can make sure you all have access to it. But Dr. Wade Nobles really talked about Zolo Up, which means love, and it activates our self-healing capacity. So this means we have self-healing capacity, right? We know this because our ancestors have been there and done that. How do we activate it? And he proposes 5 things. The first is remember. Again, very consistent with what I've been talking about. We got to remember who we are. We got to remember our history, who we are and where we come from, and being able to tap into those strategies and those strengths that come from our ancestors. Remind, again, very consistent. We have to be reminded that we live in a society that's oppressive, that's racist, and it's going to impact us at a higher degree than any other population. So we have to remind ourselves that that's the circumstances that we are under. 3 is refrain, very consistent. We must refrain from resorting back to suboptimal Eurocentric ways of thinking, believing, and responding. Again, when we are in crises, unfortunately, by default, we go back to past negative coping strategies that we've been socialized to believe. So we want to refrain from doing. Yes.
So they're saying no sound again, but I know last time when Robina jumped in, it came back. So can you all hear us now?
Yes, can hear you.
Okay.
Okay.
Thank you.
Do I need to go back? Can I keep going?
No, I think it was like 20 seconds that time, if that. Oh no, they said no sound again. I don't know, because I can hear you the whole time. So it's just coming and going for some people.
Okay. Well, it's being recorded, so if people need to go back and listen, let's try to do that. I'm gonna keep going because I know time is limited. All right. So we want to refrain from resorting back to suboptimal Eurocentric ways of responding and interacting and believing when we're in crises. We want to revitalize. So now is a time to reevaluate, reconnect. We are at home with our children, with our families. How do we strengthen our relationships? How do we strengthen, our rituals and reground ourselves culturally and spiritually? So we want to do things that's going to revitalize our families and our communities. And this is an opportunity to do that. And in his article, he has some very tangible examples of things that we can do to kind of help us revitalize our families and our communities. And then we want to celebrate. So we want to reward and remember the celebratory things that we have done as a community and as a people, and we want to make sure that we build on that and continue to celebrate those gifts, those strengths, and all the great work that we are doing and that we have done in order to continue to survive this pandemic. So I encourage you all to really refer back to the 5-Star Family Enhancement Plan and put some of that into practice. He also talks about some of the herbs and vitamins and nutritions, again, that our ancestors have used to survive, that we can remember and tap into it and use some of those strategies as well. So make sure you guys refer to that handout. Similarly, Dr. Mike provided a handout, an article on knowledge of self, which is very consistent with her theory, therapy that I referenced earlier. But again, it's this whole premise of knowledge of self. And the more knowledge we have of self is really going to protect us against the oppression and the Eurocentric ideals and ways of the country and of society. So we want to make sure we remember and stay grounded in who we are. We want to learn more about ourselves, one another. We want to build trust. Our priority should be given to strengthening our relationships with each other, have some self-compassion, grace, and forgiveness. We need to learn and love our true divine selves, liberate our hearts and minds from the suboptimal, increase our courage and commitment in standing up for what is right, and again, fulfill the role we have played historically as the moral and spiritual leaders of our time. Now, again, I'm telling you at least 4 different ways that we can tap into our cultural selves and really begin to liberate and practice and get back to understanding our African-centered values and principles and rituals, but there's overlap. So whether I'm talking about Maya, Nguzu Saba, Dr. Meyer's work, or Dr. Babawe Noble's work, it's all very consistent and similar. So again, walking away with strengthening our relationships, our families, getting regrounded into who we are as cultural and spiritual beings. Again, these are the things that our ancestors relied on historically. So if we can tap back into that, it's really going to help us survive and recover and prepare ourselves for future pandemics if we have to, unfortunately, be faced with that in our future. The BSA principles is connected to Dr. Meyer's work, belief systems analysis. And again, she offers 2, 4, 6 different principles that we tend to use to kind of help keep us grounded in an optimal worldview. So making sure we have a holistic worldview, meaning we have a holistic way of looking and conceptualizing everything that's going on. So our history, our modern day and current experiences, right? Not just looking at all the negative that's happening, but what are some of the gifts and good that is also coming from this pandemic. So having a holistic worldview as it relates to how we're understanding what's happening and what our responses are will help keep us grounded in an optimal worldview. We want to make sure we stay grounded and connected spiritually. So we want to continue to develop as spiritual beings, understanding that our spiritualness is what helped set our ancestors up for survival in our past. So how do we continue to grow and develop as spiritual beings? As it relates to our intrinsic self, being able to understand who we are intrinsically, our internal divine purpose, our gifts, who are we, our character traits, and how do we tap into that to continue to strengthen our circumstances and our relationships, right? We don't want to resort back to extrinsic self-worth, which is grounded more in materialism and having an individualistic perspective on as it relates to how do we survive and cope. The extended self-identity, again, really understanding we are a part of our ancestors. What did they do? How did they survive? How do we help our families? How do we help our communities? How do we help the yet unborn, right? How do we tap into our higher power? Understanding that we are a part of our higher power, our ancestors, our community, our family, the yet unborn, and understanding what we do and what is done impacts our extended self. So how do we hold on to that and be able to exemplify that in terms of how we're responding? Diurnal logic is the opposite of a dichotomized thinking. So we don't want to think in that either or black-white perspective. Why? Because it creates anxiety and distress. But having a diurnal perspective helps us look at both and. In particular to the pandemic, there's a lot of negativity, unfortunately, that has happened, but we are placing a lot of emphasis on the negativity, which is creating distress. So how do we also look at some of the positive or the good, right? Some people have been forced to slow down. So now we can be more intentional about strengthening our families, about regrounding ourselves in our spiritual and cultural selves, right? That's a great thing. It's going to help us overcome, survive, and liberate. So when we think about it, we want to also look at, okay, what are some of the things that is happening that, that is working, right? Some people are talking about being at home and being able to cook more. Some people are talking about being at home and being able to spend more time with their kids doing their schoolwork, right? So it's not all stress. There is stress. We know that. But sometimes we want to be able to tap into what's also working and make sure we hold that balance so it's not one-sided and we're so immersed in the negativity that we can't really function and it's debilitating us. And then that whole knowledge of self again, that Dr. Myers presented and produced a new article on as it relates to how to do that. So those are the BSA principles that we also want to make sure that we tap into and hold on to in the midst of this pandemic. This is just some ideas of rituals. So if you don't have rituals, here are some ideas of rituals that you can begin to use and practice. I encourage that you start and end your day with a ritual. I encourage you, if you do have children at home, that you get them to starting and ending their days with rituals. Again, having that order and balance and doing some creative family activities that's going to help really strengthen the relationships. I think, again, grounding us in our families, in our rituals, in our values, our principles is really going to help us to overcome and survive this pandemic. So this is a list of rituals that you guys can begin to practice. And again, it's not limited to this, so feel free to share others that you might be doing if there's things that you might be doing that could be of value to the rest of the community. I want to end with these African proverbs that I think is very, very consistent and important as it relates to what we're currently dealing with. Knowledge is better than riches. So again, the more knowledge that we have, that really is going to set us up as it relates to how we survive. And it's better than riches. When spiders unite, they can tie up a lion. So let's unite and tie up the lion that we're currently dealing with as it relates to this pandemic. He who does not cultivate his field will die of hunger. So again, speaking to the collective effort and grounding ourselves spiritually and culturally, if we don't do that, we will die of hunger. So just remembering these proverbs, again, starting your day or ending your day with an African proverb will serve you well as it relates to being intentional as you move throughout your day-to-day activities. And again, my absolute favorite is walk like you have 3,000 ancestors walking behind you. Because guess what? They are walking behind us. And we really have to tap into our ancestors, call upon our ancestors, and remember the struggle and the survival, because that's exactly what we need to do currently in order to survive this pandemic. I will leave you all with that, and I will open it up for questions, comments, or feedback. Thank you.
Thank you, Dr. Tania. So I'm going to go back to just a couple comments that were made. I already addressed the one about the language. So someone mentioned that we have to keep in mind that many were not diagnosed with COVID-19, but said to have it and said to have died of it, but no test or diagnosis. The numbers across the board are likely skewed. So I think they're just referring to the fact that, and I think this may also be connected to the myths about, given what's going on right now, oftentimes if people are going to the hospital and they're not making out, they're kind of just saying that it's COVID-19 without being tested for it.
Yep, that's correct. And again, the more knowledge and facts that we have can kind of help us to really understand what's happening. But absolutely.
So someone else in relationship to the myths was asking where they came from.
Where did the myths come from?
Yes.
You know, that's a great question. I just think that, you know, I know they were circulating all over social media. Again, it's something that we've heard a lot in our community here in Akron, Ohio. So again, I'm not sure how much of that has translated throughout the country and what you all are hearing in your own communities. I don't know where it came from, honestly, but I do know that it has really impacted people's response to it, which has unfortunately contributed also to some of the negative outcomes we have been seeing with the African American community. But I don't know how we come up with these things. It comes from being miseducated. And it also comes from not trusting, you know, the system, right? And we have every reason to not trust the system. But again, we don't want to dismiss things. We want to critically evaluate and see how it fits our context.
Dr. Lodge, would you please repeat those African proverbs?
Yeah, I'll go back. There they are. Can you see them?
So another, I guess the question that was kind of connected to a question that was asked earlier about members of the Black community who may be hesitant to wear a face mask because of racial profiling. Other participants were wondering, so I don't know if you've seen videos about like the two brothers who were in Walmart and were escorted out by a police officer because they had on a face mask. So I guess what guidance would you give related to that? Like, of course, you want to try to protect your community, but because of racism, we're now in positions that it may not end well for us if we are wearing a face mask because we may be seen as criminal.
Yes. So do you see my point? My point is we are already dealing because that stuff was happening prior to. Now the pandemic is exacerbating it or highlighting it more. So again, what were we doing in response? Like, how do we deal with racism? Because that's what it is. That's flat out racism. And so for me, one of the things that again, so we respond in a way that we can keep ourselves safe in the moment, understanding that, you know, getting into confrontation or, you know, being combative can also result in us being killed by the police, unfortunately. But again, for me, when we encounter racism, sometimes it's very difficult. Like, there's nothing we can do about it as it relates to making police officers not be racist or helping white people to not be racist. Like, we can't change that. What we can do is buffer ourselves. And so making sure we don't internalize these racist acts, right? Because that's what happens. We deal with we experience racism, and then we internalize racism. And when we internalize racism is where we see the self-defeating thoughts, the self-defeating behaviors, and then the unhealthy coping strategies. So we want to make sure we're able to say, that's racism, right? Call it what it is. I'm not sure if there's anything more that we can do about it in that moment to keep ourselves safe, but the internal psychological work that I can speak heavily to is, let's make sure that we call it what it is, put it into context, and not internalize it, right? So I don't know if anybody has anything to offer, but I want to make sure we keep ourselves safe in the moment so we don't have tragedy on top of tragedy, but also making sure we don't internalize. And again, as Dr. Bobby Wade Noble said, we got to remember, right? That's what it is. And this pandemic is not doing anything but highlighting the intensity of it. That's what I got.
Thank you. So I think I'm caught up. I have one question, and then Dr. Vance has a question after this question. So someone wanted to ask how grief is presenting in our community. I don't know if you've been exposed to it or you've dealt with clients who are grieving right now in relationship to COVID.
I didn't get the question, Brittany.
How is grief presenting itself in our community?
Grief.
Yes.
Oh, grief is significant. So here's what's happening. And yes, I am aware of friends who have lost loved ones. And unfortunately, we're not able to, we think we're not able to have like our normal, you know, funerals or, you know, ceremonies that we will have when we lose loved ones. So not only are we losing loved ones, people are dying, but we're not able to have the ceremonies that we would have. So we think, but Dr. Ethiopia, our current ABSI president, was sharing with us, like, no, and again, very consistent with what I'm saying. When we go back and look at our ancestors didn't always have access to physical bodies, right? But we were still able to celebrate and do things to kind of honor our loved ones as they have gone on. So I do know that grief is presented in a way, not only that we're actually losing people, but we're not able to have the ceremonies that we were having because of the pandemic. Again, there's a lot of grief and loss related to people's just lifestyle changing. People are losing their jobs. People have lost relationships. People have lost their income. People have lost their, you know, just way of life. Things have changed significantly. So grief is actually presenting in multiple ways. And I think the important thing is that we understand that that's what that is, and that there will be a process and what kind of support and strategies we need to kind of use to support that process. Because grief is a long-term process, right? It's not going to happen today and be done tomorrow or next week, or maybe even weeks after the pandemic is over. It's a long-term process-oriented experience. And so understanding that we're going to go through that for a variety of reasons, again, it's just not connected to losing loved ones, but just losing the different experiences and the different resources that we were once accustomed to. But again, I would also say pay attention to the fact that, again, we lose who we are in our cultural and spiritual selves when we are in the midst of a pandemic. And so we want to make sure that we don't have to grieve that as well, but remembering, you know, again, our ancestors didn't have access to some of these things that we've had access to, and how did they survive or continue to celebrate or acknowledge those moments, I think is what's going to be very important to remember.
Okay, thank you. And I think that was the last question that was in here before Dr. Vance. Hey, Vance, wanted to ask his question.
Hello. Thanks, Dr. T. As always, it's such a pleasure to see my old supervisor, current mentor, all the things, we're still connected. My question, ironically, was really similar to grief. Currently living in New York City, we're really impacted a lot. I lost a family member myself. I have students who are constantly losing family members. And when I think about grief, I think about two different types of grief when we actually lose somebody, and also anticipatory grief. That the fear of in the future of losing somebody or something. A lot of our Black people, our African diasporic folks, have this instinct to run to that loved one. How do we encourage folks not to run to that family member and jeopardize their own health? I know we talked about the virtues of M.Ed, about truth and sharing that information, but I think that takes a little bit more cognitive space for us to sit down and think about that. But in the height of the emotions, how or what suggestions would you say to kind of refrain people from putting themselves at risk?
Yeah, so that's a great question. And I also want to highlight, I don't know if you all are aware, Dr. Vance also, you produced an article that talks about the grief as it relates to the Black community. So I think that's, and please share that resource with everyone, because again, I think it's extremely valuable. But I think what's happening is people are running because they think that that's it. Again, people don't know what to do. We don't know anything different, right? And so being able to provide the context in terms of, number one, you want to make sure you keep yourself safe. But if it's a matter of fear in terms of how do you, say goodbye, how do you grieve, how do you have a ceremony? Again, we don't know that, and we're not thinking from that perspective because we are in crises, right? We are at risk of losing a loved one. All we want to do is get there, hold their hand, and be by their side, which of course that's what we want to do. Unfortunately, we are in a situation where it puts everybody's health at risk. So yes, being able to provide that information, again, any kind of historical context that I think will help people receive it better. And I think people who have options or understand what their options will be moving forward may be more receptive. But I'll tell you, we are a people who are grounded in the things that we know, right? And so it's going to be very hard for us to succumb to some of those kinds of recommendations. It's just going to be hard for us. And when it's hard for us and we do things that put us at risk, it's more important for us to really understand it in context and not become divided or angry with each other or, again, turn inward and be against each other, because that's against unity. And again, that just creates more problems for us as a community moving forward. So I just think educating, making sure we have the facts, we have the historical context, we have understanding of options and alternatives that we can do to say goodbye to our loved ones or to celebrate them when they are at risk of unfortunately moving on to the ancestor world, that we are able to have that understanding, and hopefully that's received better and people will make a different decision in that moment.
Thanks so much.
I don't know if someone else was I think I heard someone else about to say something. Okay, so this is related to what you just got done speaking about, Dr. Tania. So in terms of the community, when it comes to talking about ancestors, how do we talk about that when it may be taboo? Because you just said like the realm of the ancestors, like for a lot of Black people, that may not be common language that we use.
Mm-hmm.
So how should we go about addressing that?
Yeah, I think that's an interesting question. So here's the thing: when we're talking about who we are as African-centered people and our understanding of our African-centered belief and spiritual understanding, we honor our ancestors. So again, if people are not open to understanding who our ancestors are, I would just encourage you to talk again, always going back to history. And then how do people understand their existence? So for me, I like to ask questions, and asking people thought-provoking questions about how they understand their existence or who they are a part of can help them come up with, if it's something aligned, because sometimes they are connected and they just don't know it, right? I remember talking to someone who was almost in a car accident, and again, who doesn't necessarily believe in ancestors, right? But again, avoided a car accident, and after the car accident said, oh, that was my mom protecting me. Their mom had transitioned, right? That's you acknowledging your ancestor. Sometimes we don't know that that's what that is. So again, I just think it just takes a lot of educating and asking thought-provoking questions that allow people to examine it themselves versus us trying to just give them the information that they may not be open or receptive to. In Dr. Meyer's work, the first phase is people examining their own worldview. So you have to examine it first before you can then teach them something that's going to be more consistent with who we are culturally. So that's what I say. You got to ask some thought-provoking questions, because again, sometimes people are connected that way, they just don't know it. And again, just help them to see it, or to see how it is playing out for them, impacting them or not. Yeah, I think that's a great question.
Yeah, thank you. I think that was a great answer, because I think you hit the nail on the head. When we acknowledge things like that, and then you kind of make that connection, it's like, oh, I am talking about my ancestors when I make comments like that.
Absolutely.
So I think that was the last question that I saw. If I missed anything, I apologize, but definitely feel free to jump in and ask a question if you have one for Dr. Tania.
Yeah. Again,
It's breaking up.
can't hear me now.
Just barely. It's like hard though.
Okay. Now I was just gonna ask, like, how, if I could just try to talk maybe again, but how do we as a community, like, I guess before track the data, what's going on during this pandemic, as far as like the negative adverse treatments that we're experiencing, so that we can go back in retrospect and actually study it, prevent it from happening.
Did you hear that, Dr. Tania?
I didn't get it, so I'm hoping you repeat it, because I can't hear.
So he's gonna have to fill in the gaps that I missed. I think I missed a lot of them. So I think he was asking, how do we like go back to maybe how things were prior to, after all that's currently happening within our community?
No, I was saying, if you can hear me, I was basically just saying, are we keeping track data-wise? Like, let's say something's happening where people feel like, okay, I can't wear my mask because I'm being harassed, because people think I'm a suspect, and all these things that people can. We have a database for tracking this type of thing, for information throughout the country that we can use later on to address these inconsistencies, where we shouldn't feel like we don't have the right to wear. We shouldn't feel like we don't have the right to protect ourselves from this type of injury that can come from this pandemic because we're Black. You know what I'm saying? So in the future, how do we track all this information throughout the country so that we can better address it?
Okay. Did you hear that, Dr. Tania?
Yeah.
So I think I was scroll back up. So I think in the chat, the question was, how are we as a community tracking data related to this pandemic that we can look back on And I think just now he referenced, like, if we're not even able to protect ourselves, because if we wear masks, then that could be a problem too. Then like, how are we addressing all that as a community? Is that accurate?
Yeah, very much.
Feel free to put it in the chat again if I didn't catch everything. I'm sorry.
Okay. So yeah, I think as a community, we are acknowledging and addressing those things. I think ABSI is doing a phenomenal job. And again, it's taking time for us to really track the data, to put it out there, to come up with the strategies and resources for us to continue to survive the different things that are happening. Like all of that is happening now, which is why I'm doing this webinar now. So how do we use the information and knowledge that's being shared to take it back to our communities and either live by it, exemplify it, or share that information with our people so we can remain healthy and as safe as possible until we get through this. But you're right, because we are living history, it is our responsibility to track exactly what is happening, right? Get the data, how we're responding, how effective are we being, how impactful is it being? Because again, we are now going to be the ancestors of those that come after us who may also unfortunately have to experience this one day. So we are doing, we're working very hard to make sure we capture the data and everything that we're doing in response and to put that out there. But again, these webinars and the virtual healing circles that are going to start, all the education that and resources that is being made available, we want to make sure we are tapping into that and that we are disseminating that, using it in our personal homes and personal communities, and we are disseminating that information to the collective, because again, it's the knowledge that's going to help us. A lack of knowledge is going to destroy us. It's the knowledge of self that's going to help liberate us. So the more we understand that, I think the better off we'll be as a people.
Okay. He said thank you. So I don't see any other questions, but there was a comment. I think this may go back to like traditions and rituals. Leslie Scott Jones said, I started the conversation with my very traditional mother by showing her how to create an ancestral altar. So that's just like kind of sharing some of the things that we can do to help.
That's right.
Yeah.
Right. Well, I'll leave you all with this. The more you can ground yourself in who you are, reconnect, or be more intentional about rituals and African-centered values, virtues of Mayat, Nguzu Saba, the 5-star family plan, the more we can be intentional every day about relying and using these strategies, the better off we will be, right? History repeats itself. We've been here before. This is what our ancestors relied on. This is how they have survived. We know they survived because we're here having this conversation right now. So the more we can understand our history as it relates to what we're dealing with and how to respond to it, educate each other, ground ourselves in our values, principles, and our spiritual selves, the better off we will be as a people. So I encourage you all to just work on being very diligent and intentional about practicing your rituals and grounding yourself in African-centered practices. Again, tons of research out there that talks about the benefit and the protective nature that this work and our philosophy developed by us have on us as a people. So just be very diligent, and again, knowledge of self is the key. Lack of knowledge destroys us. Knowledge is better than riches. So I will leave you all with that, and I just really thank you and appreciate an opportunity to share this with you all, and hopefully Brittany will allow this to be available along with the subsequent readings that I referenced for your resource.
Yes, so myself and Robina, everybody who is in ABSI member will definitely be given access to this. Those who are not, the video will be posted on our YouTube page. And someone asked about the PowerPoint. So we will try to figure that out about how to get that to non-members, or even by reaching out to whoever you got access to this from. They should be given access to all the information that we shared today. So I also wanted to thank Dr. Tania for presenting this for the student circle, but to everybody. And thank you for everyone who participated, especially with the short notice and the change in links. We had to do a lot of things behind the scenes this morning, so I appreciate everybody. And also Robina, she's having technical difficulties right now, so we can't see her face or hear her. I don't think her microphone's green, but she tried to talk a little while ago and we couldn't hear. So I just wanted to thank her because she did a lot this morning to adjust the links and change up everything and create a new flyer and send that out. So I just wanted to thank her. And I think that's everyone saying thank you, and stay safe. So yeah, everybody take care of yourselves. Practice everything that Dr. Tania discussed.
I love it. Bye. Thank you.
Thank you.
Bye, Brittany.